Welcome to Nltv, someone of ours. Viewers kan achi amahan Dimapur district hospital de aina se. Aro yede Dimapur district ya tha to yo amahan ekta research do le aro huta bachi do le yede aina se. Aro tu ki asin do mental health issues la gani amahan yede aina se. Abhiyan jane se achi kali do mental health issues bi ekta issues our issues or training ekta issues IB itu logo de amihan yate Dr. Younger psychiatrist Nodal Officer District Mental Health Program Dimapur aro tailo yodo Mental OPD aro de-addiction center District Hospital labi ai Nodal Officer ase IB tailo de du kotha bachi boli na mental health issues la tailo de jami boli koshish karo. Welcome to Nltv sir. अच्छा सर आपने भी जानिए से अच्छी कली दो हिलो दो एकता चुली लगा दो और अमाउंट में यूज़ चुली की ला ए चुली भी मनमान तंगुली चुली भी एकता इश्यूज चुली लगा दो मेंटल हेल्थ इश्यूज ला और शिव ला से तो हिलो दो आमी आपने ये उठी उन्नत दो हिलो दो on a introduction करने itu mental health तो हिलो दो ऐसे अपनी नोडल ऑफिसर अपनी किना ना एड्रेस को खता पर पर भी नहीं
complex ase kata bra kobo nabaribo koili mane kunda bi kobo pare only be in short kobo mental health issue address koriboli to there is no simple formula. It should be a collective approach including the stakeholders, say the government, the churches, the NGOs, including the village council, the youth organizations. It also collective approach hobo lage iniga kurigana be kiman dak succeed hobo kobo nabare mogana. We don't know how successful we will be even after doing that, and that will contribute a lot if they are all involved, because it is the awareness that needs to be increased first.
अच्छा तो regarding about mental health issues sir, current trends and issues la the what are the most pressing mental health issues today and what have they evolved recently?
It is an ever evolving area. दूसरा medical illnesses होली माने things are fixed. Mental health होली माने it is a very vague area. There is no clear-cut demarcation, no boundary, and it is ever evolving. And with the current civilization, modernization that are taking place, it is going to become more and more. And then the most pressing issue today would be among Nagas, at least in Nagaland, it would be awareness generation, to create awareness about what mental illnesses are, or to bring down the stigma associated with mental illness. It one line the focus करबोले पिछे important है सर.
अच्छा सर आमी बुद्धू मुंजा तो mental health issues ला बताओ कुछ लोग आमी लगा अपना रो आमी लोग मुंजा तो bipolar disorder भी है ये schizophrenia kan भी है ये insomnia kan भी है ये और इसी है ये तो ये लोग अपनी itu लगा और ये अलग-अलग बीमार mental health issues से अलग-अलग बीमार की ऐसी हुआ अमान्य highlight करी वो.
Mental illness कोली माने there are more than 200 different types of mental illness इनका से दे इतो खाली पगला वगैरह बिराय थका इतो कंदो ही mentally ill इनका नोहे दे. There are more than 200 plus different types of mental illness. और इतो कंदो they would fall in different categories. Classify करूँ कोली माने classify करूँ परे. अलग-अलग type आसे we have a list of the cases that have been coming here. ये ये सब लिखिएगा ना आसे. तो all varieties of mental illness आसे ते दिमापुर दिविना यदि patient ना है हिसाब तो all varieties of mental illnesses to come here.
Sir तो अपनी कोला हिसाब तो हमारा ना society में और दिमापुर दिवी mental illness लगा तो अपनी दिल को लेके तो ये अपनी यदि दिमापुर district के कोई की ना so far apni case kiman handle koriche aro case handle korala bode apni laga ekta experience which apni life ke du practice kori na apni ekta revelation na itu apni ek par bhi ekta incident face korishna kore mental health pra
Revelation God, that is difficult for me to understand. We always maintain a record every year. Fortunately, it coincided. We at the end part of 2022 brase. Our 2022 August, September to August laga data collect korigana ase, and we were working on collecting data from August 2023 to September 2024. Ini la stage te thaga damne abuni an thick time te aise. Yadi cases ado mental health program to 2016 bra start kora ase. Sai gana ado achi tak sai limane the total patients that we have seen is 12,342 iniga ase te. And if we are to break up, supposing the highest was in 2023, 2,085 patients aise. Our 2024 de January till August de 1,694 haigana. It will cross the number of patients that had come last year in 2023. That is what I expect.
Sir, regarding about the diagnosis or treatment of the survey, so apni laga from your end, itu laga treatment laga the key procedure or treatment option di nalakan di mula key option effective as like alag case yung dibikin lebih ekta key effective as treatment lang kani
diagnosis and treatment laga. It is very complex. No two patients would have the same presentation. It will depend on the problems with which the patient have come. Accordingly, diagnosis currently it is not simple. In many cases, we may have to go back to amalagapet pitori haganmikininga thakishi. Delivery, home delivery na hospital delivery. Delivery time de complication thakishna thaganai pacha tangura time de thick time de kutha grubli start hoishna wanai. Thick time de walk grubli start hoishna wanai. Schooling start करने के निका थकेजा academic performances school हमरा complaint थकिश ना थकना इनका सब तो साई का ना आई बोले बोला ही चाहिए ना तो arrive at a diagnosis इधर वन सब तो लोग ना again we will go more in detail about the presenting signs and symptoms for which the patient have come. It वन सब साई का ना we do come to a diagnosis. Now diagnosis squad I'm there. It may not be that the first diagnosis is the last diagnosis. Mental illness did I said things are not very clear cut. Zap 1, 2, 3, 4 in the system no way. The first diagnosis may change in follow up. Maybe on the first day we may not be able to arrive at a diagnosis, but in the follow ups maybe we would be able to arrive at some diagnosis. Iniga diagnosis line to be iniga chaide. It is not it is not very simple. Treatment line, there are many medicines available. We have antidepressant, anti-anxiety, antipsychotic, sedatives. There are many medicines that are available. So, it can manage kore psychoeducation de kutha kura bra pishi relief by patient kanto. Kunuba to clinical psychologist lo TV patay for therapeutic intervention na. That is how we give the intervention and treatment.
Sir, aro apni patient laga treatment laga ote mwangi update right she olibi apni laga as a apni nijor chuli gina apni nijor jani as a apni as a doctor apni key strategies for patients kan apni laga ekta mantra.
One I can say confidentiality. Patient kini ka ekta helibi I maintain confidentiality. Mui laga nijo khor manabi hobo pare, jina jini manabi hobo pare. Ki jane abuni bra janina thaga manabi hobo pare. But I make sure that confidentiality is maintained. I may not tell about the patients that I see, even to my wife for that matter. forgetting about telling to other people. The confidentiality is one thing which I strictly maintain, because that is the right of the patients that I see. And apart from that, treatment eko alak mantra to na, as I said, treatment approach differs from patient to patient. Same treatment applicable to two patients in na. Treatment approach will differ according to the presentation. There is nothing fixed on that. So the only thing that I can say is fixed is the issue of confidentiality.
So, sir, Mohana society na ka society to Mohan ko ile chutu ekta area de chutu ekta population ase. Maybe amhan kita sa issue to Mohan naga manu ile do enaga la cases to ile to tahan patient ye counseling dibu no ina right path ke pothabo no ina wota patients kan ye avoid ko ile to tahan ro traumatize hui je ina tahan la health issues bi enaga hui je aro enaga de counseling no ina alak kiba ko no ina ini alak treatment no kan di yang dibi chwa choi guna to ile to apni laga insaf te itu hal laga stigmatize kura do ile to what can be done to address the issue.
See, I cannot blame anyone. Kun huli bhi ekta family de pacha ekta mental illness develop hoise guli mane parents will try their best and try to give the best help and treatment possible to the son. Let us say a son is having mental illness. Our baba ama ekta nishna tagan praki chane itu sab treatment de de. Now there comes the role of awareness. If they are not aware that this is a mental illness, the trend is awareness takana gulimane hawa pia lagishe. Saidan la kam ase kunurbar chatu mare dishi nikala line di chai, and I cannot blame the parents because they have no awareness. The reason why I say awareness is very important. Inika hui jabra tu inika la sender de lui jale palo bunagi chatu wala lot lui jagana chat manukan ba chatu mara do pilai di bule hi try guru bunagi. That is one thing that I see a lot. Yate local bhi aahe, non-local bhi aahe. My observation is local aaga no pishi muina alag sandari lui pirega na haide. Non-local aaga to ek hafta 2 hafta machute after developing the mental illness phat hai jayate. So I was trying to understand what the problem can be. Then I realized that it is the matter of awareness. Awareness na takapray indikakan sop hui takina. I hope I did not go off track. But what was your main question?
Itu apni kui takala do itu la kotha se ami bi directly hit kuru mona na wrong treatment de itu wan la do itu apni halo de ahan ho na alak wrong treatment gura hala ko ila kina yes itu.
Acha okay.
Yes.
Yeah.
Aro sir apni wala subject treatment la do apni han counseling bi de guje medication bi provide kore guje do ile do amahan ye dia ina saina cha do ile technology laga apni advanced technology laga ina treatment de available asena nai aro apni laga hisab te do thakile do kharasena.
Yes, we have to go in line with the advancement in technology. We cannot lag behind. All other areas of development, including mental health related areas, it goes in line with the advancement in technology. Pishi thakibo all over the world, artificial intelligence tak apply kuri ase manukan to. Though I have not much idea about that. Well, at least in Nagaland, one thing that we had started taking advantage of the advancement in technology is we have started an online counseling program called Telemanas na. Huningana thakibo hola Telemanas na. Tade ekta contact number ekta de where you can call up. Contact to you can call up 14416 inika ase to tate call korisu gole mane tate trained counselors kan ase. They will give expert counseling phone ba hoile bi phone ba will be hopai na thakega na. If psychological stress is happening in a remote corner of Nagaland, they cannot reach the township area, meet a psychiatrist or a clinical psychologist. In a situation, they can call up this number 14416. In a expert trained counselors are there. They will get back to them. In a they will get at least some counseling. Or what they provide is not only counseling but psychological support also. So that is one advantage that is in place in Nagaland. Delhi Manas Koiganana. There are many other areas like research tools are getting more and more advanced. Accordingly, they are applied in further research related with mental health. And then we get a better feedback and based on which policies are framed as to how to deal with these mental health issues. So ito nishna advancement kana pishi jai thake bo.
Sir, mahan khobor pala insa ke apna research message. To research je one janyo ba do. Apni do khali yade ai na office ai na treatment aro patient ye itla na sai na apni bahar de churches be involved with the mental health issues like patient raise na aro awareness kuna bera share aro NGO society kumnumra apni ki mati na libi apni program attend kuna itu la awareness na apni play de so itu shikal kota libi ami hujum jado apni laga emas sal care de apni criticism aro challenges kumra bi individual bra society bra libi face kuchna karnes
itya tak to criticism iniga to face kurana aro face kurji bolibi to hando mila timak tin na take maybe I don't the reason why I don't remember criticism can face kurana kurigana thakilibi since I don't take such things seriously it is not in my memory which is a part and parcel of everyday life. There are some who criticizes, there are some who are supportive, which is the part and parcel of life. Challenges related to Pishase, especially in my practice, psychiatrist Kumdiase Nagalande, we are hardly some actively into clinical practice, 6-7 of us only. Itla over qualified clinical psychologist, Pipishi Kumdiase. So those are the challenges, including me here. So many patients come. I am the only psychiatrist here, district hospital there. So it becomes difficult. I cannot take even 1 day leave. 18 leave by Shugulimani, itu 3 la patient, next day I jabo, and next day to mula matha khabo. I would not be able to give quality treatment once my higher brain center gets heated up. So that is my personal challenge that I face. Apart from that, in relation with the patient, the attitude, the biggest challenge which I see is, as I said, I am repeating, awareness, creation of awareness. And as you rightly said, I do get involved in many other activities, different platforms. Not that I know everything, but I try my best to impart whatever knowledge that I have whenever I do presentations in whatever platforms. That is where I am involved in.
Sir, on a lighter note, when we talk about the mental health issues, apni yak mohan ke tetabi mohan ke guys. Mental health issues so motahi bisi face korna maki bisi.
Moi saya kana kubode. Itu September 2023 bra August 2024 tak jama kurasde. That is mui ade ahatin isap bra September bra lobole like 1 year na. So September 2023 to August 2024 laga data compilation asde. The kind of cases, all varieties of mental diagnosis are there who come here to the OPD. Aru muta maiki laga hoti she apni bra to yati likhigana ase itya tak to mutahi pishe aigana ase yati na mutahi pishe aigana ase maiki bra to treatment karni na aru apni muta maiki laga I don't know whether we are taking too much time. Only muta maiki laga kotha kora them de mental health related activities there, research kora, focus kora, it was of the mostly on women's mental health, child's mental health, adolescent mental health in nika lagate asite, and iman focus to nitena men's mental health te, inika to naito, iman focus no kore, iman research pi no kore. Taking opportunity of this interaction, I would like to say that men's mental health would be next most important after adolescent mental health. In my personal point of view only, and why I'm saying this is because they keep the negative emotions bottled up deep inside. So it catharsis language, so they relieve themselves of their negative emotions. That is what females do. And emotionally carried away, they manage to bottle up a lot of negative emotions deep inside. Now to support that fact, one, two examples mentioned Dunya all over the world, including Nagaland, suicide laga sai sabina. Muta pishi suicide kore na maki pishi suicide kore. Muta he pishi suicide kore, and that is in all the countries in the world. Muta suicide kore pishi wala ase. Second example I want to point out is alcohol is available. Drugs are available in the black market. Itu dunya de Nagaland de muta bhi ase maki bhi ase. Almost equal ratio there. How comes when in the black market alcohol is there, drugs are there, how comes mutu kha or alcohol kha to mutahi pishi ulaya ase? That is a question hai. Can there be a more serious mental or psychological health issues with the male group of the population as compared to the females? Kilimane all this happen mutaghani pishi hoya ase to. So it one sub point kurado, we need to focus on men's mental health also. So that is one extra point I wanted to convey.
Sir, itu mental health tak kamu syukur itu mental health tu itu right time di right jaga di address tu syukur itu laga impact kiman biar tak campur for a person.
Sabi in relation to an individual diagnosed with mental illness, as is in any medical condition, the sooner the treatment starts, the better is the outcome. The more the delay prognosis to the outcome, though, it may not be so favorable. So it amounts to that only as in any medical condition. In terms of the general population, the sooner the stakeholders come together and work on creating more awareness on mental health, work on trying to decrease the stigma related with mental illness, which decreases the treatment-seeking behavior. The sooner it is done, the better it will be. Because with this trend, we would be expecting more and more mental health-related issues that will bring down the productivity of the population in general.
Sir, last question.
Okay.
Apni laga personal opinion. Since itu one piece of advice would you like to give to our viewers in regard to maintain this mental health issues and how it can be prevented?
For that, it cannot be in one sentence. There are many areas.
In your opinion?
Yes, there are many areas. One opinion.
Personal opinion.
Ektahe kubo ulimane. Ektahe kubo ulimane. Okay. Ektahe kubo ulimane. Live a prayerful life. Everything will be covered by that. Everything is there in the Bible, and accordingly, if you live, then you will have a good mental health. Ektahe kubo ulimane ito ase. Our pishi kubo ulimane pishi kubo na jawo bariwo. Most important, in my opinion, is to lead a very, very prayerful life, God-fearing life. Definitely your mental health will be in a better condition.
Sir, thank you so much. Apni Nltv time kaya kami aro amahangi with regard with mental health issues na kani viewers kan ye amihan ye aro sob ke update kuri dia kani bishi thanks mula itu channel. Thank you so much.
Yeah, thank you, Nltv. Yeah, thanks a lot.
Nagaland TV, Sob Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.